Thank you guys for participating. We are going to be talking about attention. We're talking about attention deficit disorder today, ADHD, which is a term that's used a lot. Right now, it's a very popular term. People use it a lot, and it's really important if we're going to use a term like ADHD, attention deficit hyperactivity disorder, that we all understand what it means. So when you use it, you can apply it correctly. So we'll start. So ADHD generally affects these three areas of a person's behaviors and activities. So there's inattentiveness, hyperactivity, and impulsivity. And a person can be affected only in one area, or they may have an overlap. It affects everybody differently, which is why it can be difficult to diagnose and sometimes difficult to come up with the right treatment plan. But in general, when healthcare providers or specialists are trying to determine if a person has ADHD or not, they're looking for a few specific criteria. The symptoms occur before the age of 7 because it's sort of organic to the child, so it's not something that's going to have an onset after the age of 7. The parents and providers will have noticed the behaviors before the age of 7. The symptoms occur in more than one environment. Because it's a part of the child, it's not the environment can influence how you behave, but in general you'll see some presentation of all the symptoms at home and at school and with different family members. The symptoms interfere with a child's functioning, so that would be necessary if you were looking at treating something. You'd want to make sure that it was necessary because they're not coping, and that the symptoms are long-lasting, that they continue for longer than just a few months or an interval, because that could just be a reaction to a situation if somebody's having a behavioral problem, and then it can clear up. So you want to make sure that all of those criteria are met. So there's inattentiveness and there's hyperactivity and impulsivity, and the two, they work with each other and against each other in different presentations of people's symptoms. Somebody who's inattentive, they just generally have a trouble paying attention because their cognitive abilities are a little bit different, and it affects their executive functioning, which is your time management, your planning skills, sequencing, and organization. So when you have a hard time doing those things, it's very difficult to be successful, especially in a school setting. Hyperactivity and impulsivity, I think people really associate that with ADHD, the constant fidgeting, talking, the inability to delay gratification. So you're going to be really impulsive and you want something to happen right now. So these two things, hyperactivity and inattentiveness, they work together or sometimes against each other, and they create the behaviors that are challenging for the person who has the disorder. So some common hyperactive behaviors: talking nonstop, fidgeting, moving quickly, difficulty sitting, and not being able to complete quiet tasks. I think we're all pretty familiar with those. Inattentive behaviors sometimes go unnoticed because they don't necessarily present a behavioral problem in a classroom. So this is a child who misses details and forgets things. They're not presenting their work on time, they're not completing their work, they're struggling to follow directions because that is impaired, that executive functioning. And they tend to sometimes move slowly. So sometimes people who have ADHD, but they're predominantly inattentive, they go unnoticed because they're not becoming a severe behavior problem in the classroom. But if you look at their academic functioning, it's generally low because they're not completing their tasks and they're not getting their work done. Then you have impulsive behaviors, which are very similar to the hyperactive behaviors, but they're very impatient. And a lot of times you'll think that, a child stands on a chair and jumps off of it, and they don't have the ability to process what's going to happen next, the consequences of their actions. They are also socially impulsive, so they'll interrupt a lot of conversations, and that really makes it difficult for them to form friendships and things like that. So they also have they're emotionally impulsive, so they will go from really upset to really happy very quickly. So impulsivity can affect all areas of development. As you can see, The majority of people who have ADHD suffer from a combination of hyperactive and impulsive and inattentive disorders. Only 9% have only hyperactive and impulsive, but 30% have the inattentive variety that is difficult to spot and often goes unnoticed. So it's important to pick up on that and to look for the child who's sometimes just off on their own, not necessarily paying attention, and focusing on that. So treatment options. Studies have shown that there's a combination of medical and psychosocial interventions work the best to treat people who are having ADHD and it's interfering with their ability to function. So making environmental changes, when combined with specific medication, have the best outcomes for people who are suffering to the point where their life is being interrupted by their symptoms. So, in conclusion, ADHD is a difficult disorder to diagnose and treat sometimes because it presents itself as normal behaviors, but they present inappropriately. So it's normal to be active as a child, but it's not normal to be hyperactive, and it's normal to not necessarily be able to find your papers sometimes, but not all the time. But the key is to become informed about it, to understand what it means, and to be able to help as many children or adults who are suffering with ADHD to find the paths to success, because they are there and it is possible.
Good job.